Now we're going to look at sacral nutation in prone. We're going to assess to see if there is a hard infill, and if there is, we will mobilize. Okay, so we've just done the assessment with the dowel rod in the corner of the room. We want to see, is there an automatic stabilizing response of the sacrum moving forward on the pelvis? That's called sacral nutation. If there is, great, it's doing its job. If there's not, we need to see, is there a mechanical dysfunction, or is there some other neuromuscular dysfunction or motor control dysfunction that needs to be worked on in order to allow for sacral nutation to actually happen. All right, so I find PSIS here, okay? Oh, and just another note. So I have foam, a half foam roll underneath the ASIS on both sides of her pelvis, and that basically makes it to where I create a relative block of the innominate to stay relatively posterior, so that then whenever I spring test the sacral base, I'm getting more of a true nutation moment. Versus if I didn't have the blocks there, then it would be like it'd just be, the variables wouldn't be as controlled and we wouldn't be testing specific sacral nutation, okay? It'd be more of a gross kind of PA, hard infill test. So I feel PSIS, I go superior medial, and then from here I can just test, does the sacral base have the ability to move forward? And it does on the left side. And then if I go on the right side, does the sacral base have the ability to move forward? And it does. So if she had an issue with testing, then I would think that there's some motor control issue here. We need to wake up some stabilizers and get them to really be on board and do their job so that the sacrum can also nutate. All right. But if she didn't, all right, if she didn't, then I would come on to the sacral base and I would mobilize it just like I would be doing a PA mobilization to the sacrum, where I can engage the infill, right? I can bend her knee up until it feels like there's an increased hard infill, which her knee kind of goes a little bit forever here. And then I could localize through hip rotation, okay? And then I would then say, okay, let's say that it made a hard infill there, and I would have hold and traction through the leg as I do a PA on the sacral base and let it go. And I would continue to work through that, okay? So resisted knee extension is an option. Resisted hip rotation is an option. Even going into prone on elbows could be an option, or doing press-ups as well, as long as we know we have a healthy lumbar spine that's able to be extended. Okay, so this is sacral nutation, passive assessment, as well as treatment.